Good morning, good afternoon, and good evening. My name is Rich Clark, Guide to the Right Path. And today I'm going to talk about the subject is hypnotherapy versus CBT versus psychotherapy. And these are three different therapy techniques. Now, some people will have some ideas that they are very interlinked with some of the ideas, but I'm going to explain them in different ways. And then hopefully you will understand the effectiveness of them, definitions, techniques, what the training and qualifications are to do with, and also because I'm trained as a hypnotherapist and in CBT. I'm not a psychotherapist because I don't have a psychotherapy degree. So, start off with, for definitions, what is hypnotherapy? So, hypnotherapy uses guided relaxation and focuses attention to achieve a trance-like state, to access the subconscious and promote behavioral change. This is often combined with suggestion therapy or regression, or we call it timeline therapy. So, first thing is hypnotherapy works with the subconscious. Now, these next two, CBT and psychotherapy, only work with the conscious. So, CBT, cognitive behavior therapy, is a short-term structured therapy focusing on identifying and changing negative thought patterns and behaviors based on the idea that thoughts, feelings, behaviors are interconnected. Now, with this, CBT is also using only the consciousness. It does not use subconscious workings. Now, you can use CBT ideas and actually use it in a hypnotherapy session, then that will also work on the subconscious. Psychotherapy, which is a massive broad term encompassing various talk therapies, including CBT. So some psychotherapists are actually trained in CBT as well, because they train in their psychotherapy for 3 to 5 years, and then they train in CBT for a year. And this is focusing on emotional processing, insight, and long-term behavior change. And this can include psychodynamic, humanistic, integrative, etc. So these are just some of the examples of definitions. Now, what about understanding definitions? As you've read these definitions, most people usually go to a psychotherapist as they're the most qualified academically. They're usually trusted more due to preconceptions of what a hypnotherapist does. And this next week I'll be talking about is the preconceptions of hypnotherapy, about whether it's using spiritual work or so forth. And I'm going to explain that in fuller detail. But hypnotherapy is also the most expensive. Psychotherapy is also the most expensive. It can take hours, months, everything, and it has the least effective and a short turnaround. Well, this has also been proven that talk therapy without going to the subconscious doesn't change much quickly due to the patterns and social conditioning and more. So CBT also works in the very same way on the talk therapy line. It doesn't affect the subconscious. Now, if you use CBT techniques, same as NLP, neuro-linguistic programming, but use hypnotherapy to implant those commands or reframing into the subconscious, the effectiveness is greater and the change to the client works quicker. That's how I do my work. So if we think about it actually like AI, if AI, you give a very short prompt, it will only come up with a very brief answer. If you come up with a deeper prompt and a more example prompt, which goes more into the details, and you actually go into the programming of that, then you come up with a better answer. That is the difference between CBT psychotherapy and hypnotherapy. Now, with hypnotherapy, unfortunately, how effective it is, it has a lot of negative connotations to it. It's been said it's been used by secret services for MK Ultra, things like that, rumors of a form of mind control. There's also these stage hypnotherapists making people do embarrassing things. There's also people they've learned who are wanting to do dating and they can persuade people to sleep with them. There's all these different things hypnotherapy is associated with. And when you research the keywords of hypnotherapy and hypnosis, it's a lot lower in search engines than CBT and psychotherapy, though life coaching is actually seen even worse. So in the medical world, recently, hypnobirthing has been applied and the results have been fascinating. Many babies have been born shown with less trauma than previously. Again, long-term studies need to be applied still to see if this is actually effective. And the thing is, hypnotherapy was used instead as a natural anesthetic in the medical field on patients for years. Originally, it was created by the first Scottish doctors, first in the 19th century, first by James Esdale in India, and then James Braid, the latter came up with the term hypnotism. And then Mesmer came up with the ideas of mesmering and mesmeration, which is actually part of hypnotherapy. So if we go into the next thing is the techniques used. So techniques used in hypnotherapy. In this therapy of hypnotherapy is we use an induction. Relaxation is created. And this, within my work, is a safe space created. So what we would say to a client is, where's the safest place the most place you feel relaxed? And then an anchor, with an anchor is then needed. So then you would ask them for their favorite color, favorite number, and then they would use that as a thing to anchor them. And that can be that if ever they get into a state or they get very confused or they're very upset or they can't deal with it, they can clamp onto that anchor and they go back to the safe space. And it's something you can always do in case, like, especially if you're online or in person, if the person you have to leave the room or something and they feel unsafe, they can just do that. And they actually is something you teach people so they never feel they're stuck in hypnosis. So the deepening techniques of hypnosis is when you go into the subconscious, and some clients resist more than others due to protection and what the mind has created. The mind actually creates certain barriers, and that is how, however, it's achievable to access if you're a good hypnotherapist. Most people can struggle with it, especially if you're only learning, but if you've got experience, then you'd be able to get through it. Hypnotherapy is the guided imagery, is what the client sees of a past event, and now how they interpret that as an adult. And in some cases, some people can actually see what a client sees and check if they create false memories and more. They usually will also, you will ask questions as well. So you'll ask questions about what they can see, how they do it. And you will notice with the body language, because you have to be a body language expert as well with hypnotherapy, as well as psychotherapy. So you can check how the person responds to certain things. Now, post-hypnotic suggestions is the command to reframe away from that original trigger that is causing the said issue. So fear of flying, fear of snakes, fear of dogs, whatever the fear is, the fear of AI, fear of technology, whatever that is. And the main thing we use within hypnotherapy is regression therapy, which is mainly used. And this is obvious because it's a past event that's happened that has caused the trauma or issue. Now, as you can hear, many of these co-align with other techniques used in CBT, hypnotherapy, and psychotherapy. And with the suggestion implanted to the subconscious makes hypnosis more effective. So the techniques used in CBT we'll go into. Now, a cognitive restructuring is the behavior experiments exposure therapy. This is to challenge the client on their thoughts and feelings to the triggers that affect them. But again, this is all done in the conscious. Now, the conscious controls 95% of the brain, but the 5% of the subconscious controls everything of the conscious. So in CBT, they do thought records and homework assignments, and it's for the client to work through, and that they come up with more reason why they act towards a particular trigger. So CBT is probably more effective than psychotherapy, but if you want to get to the deep-rooted issues, CBT doesn't do that. Hypnotherapy does. That's actually, and the only trouble is hypnotherapy, because of the private of what comes up in a session for a client, is some of the stuff comes up in a bit of a client hypnotherapy is quite surreal. So it's very hard to actually, for qualitative and quantitative data, to actually back up. Now, psychotherapy, as we know, is more, from the psychoanalysis world or anything, is now free association is when a client comes up with what's on their mind. Sometimes it's a stream of consciousness and the therapist takes on an active listening role and noting down non-verbal and verbal clues of the client. And this is when body analysis helps. Hypnotherapists actually do the same with this. We always are writing notes down, we are checking the body language, and also that's why it's sometimes good to watch a video if something we've seen or we thought we saw, and we can just go back and check it. It's very interesting to do that, and it's also how we can work very well. Another thing psychotherapists do very much is dream analysis. And this is very much termed by Sigmund Freud, the forefather of psychoanalysis, but was very much looked upon highly in the Roman Empire and other ancient civilizations. The Aborigines have a culture based around dreams. And the idea of dreams is messages from the subconscious. This is why hypnotherapy, you must check for false memories, and some believe the spirit realm. But it's not. Hypnotherapy doesn't work on the spirit realm. It is literally based on a therapeutic method, not spiritual engagement. If you want to do that, you would go to a medium or a psychic or so forth. It's very different. So the general therapy practice is an exploration of past experiences, and you'd use that with role play, emotional processing, linking why people react to certain issues, and prior to that, the breakthrough to resolve. Now, going back to the techniques can be integrated. Again, all these techniques used, you can see how they can easily interlink. For example, in a free discovery call, I would use most of the CBT and psychotherapy techniques because I'm not putting the client into the subconscious or trance-like state to find out what the issues the client has. Now, what I always want to break down for clients is the effectiveness of the correct therapy. And remember, clients' money is not infinite. It's not, though if you do psychotherapy for weeks and months without progress or change, you do have to question the validity of the practice, because you could be with a psychotherapist for years and not get anywhere. That's why some people, they say, "Oh, I've been doing therapy for years, it ain't got me anywhere," because it is all on the conscious level. Whereas a hypnotherapist goes into the subconscious, so it can change deeper rooted issues, which then change. So the idea for any client is to help themselves regain self-confidence, get them back to the best version of themselves without being triggered or affected by trauma, then onto the right path. That is why I feel hypnotherapy works better. Now, if we're looking at effectiveness and statistics of how effective is hypnotherapy, this is the difference, and I'm going to explain some of these. So psychoanalysis, there's a 38%, and this was done as the study of the American Health Magazine in 2007, and there's even newer studies. Psychoanalysis for 38% recovery after 600 sessions. Let me read that again. For psychoanalysis with a psychotherapist is a 38% effective recovery rate after 600 sessions. So that is, if that was every week for a year, right? So we're looking at 52 weeks in a year after 600 sessions. I mean, that's a lot of sessions. That's a lot of work. And that's a lot of money. And is it effective? Well, 38% isn't that great. Now, cognitive behavior therapy is very much improved. It's 72% recovery after 22 sessions. So a lot better, obviously. I mean, that's literally double. And you've done it in 22 sessions instead of 600. I mean, these are numbers they're just so disparaging. But hypnotherapy has a 93% recovery rate after only 6 sessions. So basically, you can get 3 times the effectiveness of hypnotherapy in 6 sessions in 594 sessions less than you can with psychoanalysis. So how can people say that hypnotherapy is not as effective compared to psychotherapy? Is bizarre. But I will carry on about the effectiveness. So with hypnotherapy, it can be very effective for anxiety, pain, smoking, fears and phobias, IBS, for example. And there's a famous study for IBS, Worrell et al. Showed 70 to 80% success. And meta-analysis, Kirch et al. Is in 1995. Now, hypnotherapy most effective than 70% of other treatments for smoking cessation, which makes you stop smoking. Now, as a hypnotherapist, to be honest, hypnotherapy does more than this, and it's a bit of a disservice to its effectiveness. But that is what mainly is put out there in the media and the medical therapy world. Even when I looked up on ChatGPT, this is what they come up with. So it just shows you that the literature backing hypnotherapy is very poor. And plus, without evidence, due to confidentiality, it doesn't help its cause. And also with spiritual work, when people do past life regression or Akashic records, because that is seen as non-quantitative, no proof of working. That's what it's seen as. They do not see it working. So even if you've had it done, they don't see it working. And it's one of the reasons for me why I record all my sessions is so that the client can see the change, what they've seen. And it's for my records. So I can always double check body language, what I've picked up and so forth, just in case of certain things I've missed. Sometimes when you've been working all day, you do miss things. Generally you don't, but that's why you try and keep clients down to 5 or 6 a day, not more than 10, because it's quite a lot, especially I do 2 hours for my sessions. And with this, going into then CBT. So CBT is more evidence-based talk therapy. And the evidence is what a lot of people do because people want data. And this is actually great for AI because they can have the data, they can prove things and so forth. And a company called NICE recommended for depression, anxiety, OCD, and PTSD. But to be honest, and this is what they reckon CBT, cognitive behavior therapy, was better at. But from my honest opinion and my experience, hypnotherapy would sort out these issues quicker and be more effective. But again, people are scared of the idea of going into a trance state via religious conditioning, through fear. Maybe they don't like the idea of people knowing their deeper inner feelings and thoughts because people have a charade of who they are. CBT also shows 50 to 75% of patients see improvement after 5 to 15 sessions. And the long-term outcomes comparable to medication, but are more sustainable. Now, if we go into psychotherapy, it's effective for a broad range of issues, especially complex trauma and personality disorders. Now, personality disorders, hypnotherapists generally won't go into. So, someone's got bipolar, um, it's like, and disorder, dissociation, things like that. They don't really go into that stuff. To me, that is where psychotherapists, because of their medical training, should do that. And the study shows in 2000, APA in 2012 that 75% of people who enter psychotherapy show some benefit, some. Now, considering that we're saying that 600 sessions, that's a lot of money to spend to only get us some benefit. And it's slow acting, but the deeper emotional processing. Now, that's deeper emotional processing because you're always talking to the psychotherapist about it. However, if you're a hypnotherapist, and again, not to be a devil's advocate here, but if you sort out the deeper emotional processing through the subconscious, when it's explored due to links of behavior, that can only really be done by hypnotherapists. And I'm sure there's psychotherapists who actually did use hypnotherapy. Sigmund Freud, actually, if you read his books, used forms of hypnotherapy. You can check it up. I've read all of Sigmund Freud's work, all of it, even the essays, everything. I've been reading his stuff since I was about 8 years old, and I didn't even train in that then. And I've been reading that, the interpretation of dream, interpretation of sex, all them things. I've read Jung's work, I've read all that stuff. So I have read a lot of psychotherapy, though I never did a degree in it. So training qualifications. Now, perhaps one of the biggest challenges hypnotherapy as a therapy always has faced is those in academia. Due to becoming a psychotherapist, you're supposed to take 3 to 5 years of training compared to only a maximum of 2 years for hypnotherapy. Other issues include that hypnotherapy is often not regulated in many countries, which, as you can see, is a problem. And even for myself, I've had to do 2 hypnotherapy qualifications. I did one in England, which was curative, which was NLP, life coaching, hypnotherapy. But I've had to do RTT, which was that with that work, I can then for the latter, I can work in America and Oceania. I couldn't do that with the other one. I had to go to the insurance company and I had to find out every state and everything there. Actually, I can now work in them countries if I want to. So in America, for example, certain states, Nevada being one, wouldn't allow me to work due to not having a psychology degree. So even though I was a hypnotherapist, I still couldn't work in Nevada. It's quite odd, really. Seems ridiculous. And I have thought, due to my education background, maybe getting a doctorate in psychology. I have a master's in education, PGC, which is postgraduate in certificate of education. However, to get a master's in a doctorate in psychology, I'd have to write a 30,000 word essay. The university keeps it. And though I've paid an extortionate fee to study, and instead, my decision has always been I could write a book from my experiences of working with clients or working with people, and probably look at like Helen Wackenbach who does about past life regression, or write about it from an autobiography about my work, how I've got into this work, from my background, and so forth. So that's what I'll be doing. And in honesty, I do prefer doing my work and see the future with technology, AI, as a tool fascinating to integrate. And I believe with the technology of AI and so forth, is that eventually what we see, they've already been doing in MRI scans, is that they're actually seeing people's interpretation of dreams. If they can start interpreting through hypnotherapy sessions, what people are seeing as a hypnotherapy session, I think it would have more validity as proof of evidence it works. Now, to become a CBT therapist, some suggest a degree in psychology first and then counseling postgraduate CBT training for 1 to 2 years. Again, I did my CBT training online. I actually did it with a company and I did it in a year. And I'll be honest with you, CBT, most of it, I was actually boring me because most of it, what they did was actually exactly what I'd done in hypnotherapy training. Exactly the same, especially my first ever qualification I got. Now, as a psychology degree, it's usually and typically master's level 3 to 5 years. This includes clinical supervision, personal therapy hours. Again, if you go out into the field, you do case studies, because if you do hypnotherapy, you have to do 50 case studies at least to 100 to get pass. You have to do that with most hypnotherapy qualifications. So you actually have that evidence to prove that, because if they don't think you can do a hypnotherapy session, you wouldn't pass. They do not want to put people out there. And there are people that kick off courses because they just can't do the work or they're not good enough. So there is people, you have to look at that. So again, it's all down to personal choice. And I always look at what the effectiveness of change. And to me, the answer is obvious, really. It is hypnotherapy by a long shot. So there you go. So, lastly, to conclude, the strengths and limitations between hypnotherapy, CBT, and psychotherapy. So, hypnotherapy is rapid change, access to the subconscious, and it's relaxing. When you're in a hypnotherapy session, it can feel quite a lot, but it's very much goes deeper and works quicker. A lot of people actually get bored of talking. Even though I'm talking here in this video, it does get boring for a lot of clients to keep talking. And these quick behavior changes, quit smoking, phobia, whatever, works really well. And they say the limitations of hypnotherapy may not work for highly analytical clients, less evidence for complex conditions. Now, working with some clients, I have people who are very highly analytical. And in fact, sometimes when I try and do a hypnotherapy session, they've actually talked to me for an hour before we've even gone to hypnosis. And that is because they're super, and actually they've got ADHD and all the rest of it, diagnosed as well. So that's quite complex. So we do have to work with that sometimes. But in general, you can work with highly analytical clients. That's a bit of a long stretch kind of fabrication of a myth, really. But anyway, that's what they say, and this is what you'll find on most things. So I would say that's limitations. I would say hypnotherapy has lesser limitations, but for the purpose of this video, we'll just keep it to that. CBT is very structured, goal-orientated, strong evidence base. Anxiety, depression, OCD, intrusive thoughts. Again, I believe hypnotherapy using techniques is more effective in that, but this is what they say the strengths are of CBT. The one thing CBT doesn't do, though, it can feel very impersonal. It can feel very much like you say something and I'll respond. It's not like that. It's like you say something and I'll come up with a solution and then give you that solution and you work it out. And a lot of therapists, especially life coaches, CBT therapists, they get information and they're like, oh, you got to work it out. I've given you the information, you work it out. Now, hypnotherapy is more personal to the client because they actually see, they feel, and they respond to the stimuli to change. And also because the way you're using NLP and you're coaching and you're guiding that person through that session, it is more personal. You get to know the person in a way, in a much deeper way. Because what someone can do in CBT, actually psychopaths can actually pretend to engage just so that. That's actually, if you work with psychopaths or sociopaths, CBT and psychotherapy would never change them because they would just know how to work out the therapist. Something to think about. And with psychotherapy, its strengths and limitations. Its strengths is deep-seated trauma, identity issues, relationships, and dynamics. It's holistic, long-term, deep-rooted change. But its real limitation is it's incredibly time-consuming. I mean, 600 hours to get. I mean, would anybody really want to do that? That's a lot. That's 600 sessions. I mean, I don't think most people would do that amount, but people do. May lack structure, and it's very costly. Psychotherapy. It's a lot of money. And that's why I'm very wary when people say they've gone to therapy, and I hear it, celebrities, whoever, and then they say they've gone to therapy, and I'm like, what type of therapy do you go to? And most actually have gone to psychotherapists, not hypnotherapists. And so to me, that's very interesting. They go to them, and then about a year later, you hear they go to a rehab. So clearly, psychotherapy didn't work. But again, not putting my own bias on it, but this is sort of things you listen to. And again, watching body language of someone on an interview. Again, these things I do. I watch people that they get interviewed, and you watch their body language, and you think, yeah, there was a bit of coercion there, or there's a bit of codependency with that therapist. Hypnotherapists don't really have codependency so much with their clients, but CBT and psychotherapy do. That is probably actually one of their biggest limitations. So you can agree with the points, what I've mentioned, complex issues. Hypnotherapy, I think, can solve more as the client will go into trance mode, and you can use CBT techniques, which is very effective in that. And I think that's more, will actually, in shorter term, will actually get them more to where they want to be. Psychotherapy, I believe academic has its uses, but with the world we're living in now, that needs clients to look for long-term change and to help people at quicker rate of effectiveness. Does it have a long-term presence in the field? Got to be honest, no, in my opinion. And I'm happy to discuss this as always, but I just think psychotherapists are just very expensive therapists who I don't think they have that much effective change for people. So yes, I will say I do. I've done things of psychotherapy. I've done bits. I understand psychotherapy. I'm not a psychotherapist. I've done CBT, but hypnotherapist is where my key is at, and I believe that's what is the most effective work. and I don't really want to do any more than, I mean, 6 sessions. I can do it. There's a program I do which is for 7 and you do 8, but then it's also, that's a business thing as well, to help people in their businesses and for long-term things. And that could probably be seen as longer than usual. But the reason, again, for 2 hours is that sometimes I actually, with the 2 hour session, there'll be parts of it where people will talk for half an hour, and that'll be psychotherapy and CBT. So this is why I say I can do these things, because I can understand it from their point of view. But then in hypnosis is where the main work's done. So what's the solution? If you want a solution, well, you can do it a couple of ways. You can book a free discovery call at my website at www.richclark.net and make a booking, and then see together how we can get you back on the right path. And to conclude this, is one of the things is, as a society, we need to discuss hypnotherapy. And I want to get rid of a lot of the myths. I'm sick of the myths of hypnotherapy, of how it's being regarded in all these different ways. And I think its effectiveness needs to be moved away from negativity. And then that's how we can fix the anxiety, which is one of the worst issues people have, depression and trauma and relationship issues. They are like 4 top things people deal with in hypnotherapy. And if we get rid of these anxiety, depression, and trauma issues, which then will lead to better relationships, then the better recommendations, and instead of leading people to escapism or domestic violence or domestic abuse or terrible relationships or terrible cycles of guilt or trauma, we should want to improve that. So until next time, and as of next week, I'm going to be talking about the ideas of, with hypnotherapy, is why do people think hypnosis connects to the spirit world, and why is there so many misinformation by religious groups or religious conditioning? And that is my talk for next week. So I hope to see you then.